Returning to our top story now, and the federal government's health deal with the states and territories will be signed by the Prime Minister today. Dr Steve Hambleton is the president of the Australian Medical Association, and he joins us now from Brisbane. Steve Hambleton, good morning. $175 billion in extra health money for the states. Does this strike you as a good deal?
Well, look, this is a whole lot of extra money, $16.4 billion up to 2020. This is something that the health system has needed. It's been under pressure, and it's a good sign that all the states are on board. And I guess it's a good sign that we're now starting to talk about things that are really important to the community, that is their health care.
Practically, what will this mean for the patients in Australia's hospitals?
Well, that's how we'll know health reform has arrived. If we can see extra beds, if we can see extra services being delivered at those beds, if we can actually get our doctors who are working at those beds with their patients to tell us that they feel that the funding has arrived and that they can actually deliver services, we'll know health reform has arrived.
How important is it that the federal government has agreed to lift its share of national health funding to 50% and, I suppose even more importantly, make that funding uncapped looking into the future?
Well, this is very important. We know that our hospitals have been under stress. We know that our hospitals are running at nearly 100% bed occupancy. And we know that we need extra beds, and certainly where that money has to come from is the Commonwealth. The key is transparency. When money is put into the health system for beds, we need to be able to measure those beds, and that's what we haven't been able to do in the past. We also need to see that they're engaging the doctors who are working there to make sure that they are involved in the governance at a local level. They'll be able to tell us how to fix the system and also deliver better services.
How can doctors best be engaged?
Well, look, the management of the hospital structures are going to be via the local hospital networks, and we need to engage clinicians on the front line in that structure to help manage those hospitals at the local level. They're the ones that are delivering services. They'll tell us where the efficiencies can be made. But above all, we need to make sure we've got those extra beds so we can have surge capacity back in our hospital sector. You know, we can cope with the flu epidemic. We can actually cope with the elective surgery targets. We can get people out of emergency departments.
How important is it that under this deal, a new body, the National Health Performance Authority, will be set up to basically ensure hospitals are held to account as to how they spend that money?
Well, look, it's very important because that transparency is going to allow us to actually track where the money's gone and I guess where the hold-ups are. This has been a problem in our hospital sector, not being able to track what's going on. We are concerned that there are some improvements needed in that area still, but the openness and accountability will actually help us to drive that reform further.
Will there be fewer excuses, Steve Hambleton, once this deal comes into play, for us to hear those horror stories, for instance, of patients being left in hospital corridors?
Well, look, there's a couple of good signs. I mean, one is the better transparency. We would have preferred a single funder, but we certainly want the openness and accountability. But there are a couple of signs the government's starting to listen. They looked at their expert advisory panel and they've taken some advice on emergency medicine targets and elective surgery targets. The Prime Minister herself called me yesterday to inform me about these changes, and those are all good signs.
Is it disappointed you that it's taken so long and so much political wrangling to get to where we are today?
Well, it certainly is. I think we've known our hospitals are under pressure for some time, and they certainly needed more funds. We certainly need those beds to deliver those services. So the new funding is welcome. It's good that all the states are on side and on board. We'll certainly be monitoring the process, though, to make sure that we actually get what we've been promised.
As we all will. Steve Hambleton in Brisbane, thank you very much for your time this morning.
Thank you very much.